Welcome back to my second talk on attitudes and healthcare. My name is Rune Andersson. I am part of the reference group for Asia in the Union Church in Sweden. I'm also a medical doctor in infectious diseases and a professor in global health. If you want to discuss something, my email address is on the screen. At the AIDS conference in Durban, South Africa, year 2000, Nelson Mandela had the concluding speech to us, and he said that I was in prison for 27 years, mainly to prevent my words to be heard. And you, with the knowledge about HIV, tell this message to the people. Your words are important. And one important message regarding HIV is that HIV-positive pregnant women can have healthy babies. In this large study from United Kingdom, with almost 45,000 pregnancies, only 0.8% of the babies got infected among the women receiving treatment for at least 2 weeks. And in mothers on treatment from conception, it was only 1 in 1,000 that got infection. And this program to give prophylactic treatment to the pregnant mothers and during breastfeeding, it has been gradually more and more implemented worldwide. In year 2004, it was only 10% of all the HIV-positive mothers who got such prophylaxis. Now it's more than 50%, but still half of the population in the world doesn't get this treatment, and that is a challenge for us. In the field of HIV, it's not only negative statistics. The green areas are reporting less many getting new HIV infections per year during a last 10-year period. More than 25% decrease. But in the red area in Central Asia, it is the opposite, with more than 25% more cases of HIV. So it's our challenge to work hard to support the healthcare in these areas. Regarding attitudes towards our patients, many diseases can be related to lifestyle, and that is not only in the field of HIV. In any case, we must open up for a possibility of a new start in life. The prophet Jeremiah shows us when this potter maker made mistakes, he starts again. Pastor Jonggi Cho in South Korea, Seoul, being for many years leading this very large congregation, he had a sermon telling us that the eraser is the most important innovation at any time. It's very important to be able to get forgiveness for the past and to have a new start. The Canadian singer Leonard Cohen sings, "There is a crack in everything. It's so the lights get in." And this is a picture from my home island, Dyren. We can see the most beautiful flowers are coming from the broken cliff. The solid cliff, almost nothing is growing on. But for the flowers, there need to be cracks. We also see on the trees that after having severe periods, hard time, we see more growth on the trees. And maybe it's like that for you right now. This is a picture from a brothel in Pune, India, where the Hindustan Covenant Church and this Methodist doctor, Lalita Edwards, support the work to help girls like the girl here growing up in this house to get some other work than her mother had. Coming to this house in the middle of the day, many of the women were sleeping deeply. We had to climb almost over them on the way here. Here they have microfinance projects and other projects to support the people, including production of oblates for the Holy Communion. That is shown on the picture here. One challenge is that we were discussing during a conference in Bethlehem some years ago. We know that King Herod, he killed all the boys below 2 to try to kill Jesus. And now, when Herod is no longer in Bethlehem, we have another killer of both boys and girls below the age of 2, and that is the respiratory infections. And we can see that in particular, the low and middle income countries that are severely affected. It is the leading cause of death in children below the age of 5 after the early time after birth, the first weeks. And if we look at the healthcare resources, the map is opposite. In these areas where the disease burden is high, we have limited resources for healthcare. We can, with this map, see that regarding deaths per 100,000 children, many of the African countries, but also Afghanistan, is on the top. And in absolute number, China and India is because of the large population leading. In the year 2000, a new vaccine was introduced to the small children in the ordinary childhood vaccination program the first year. And it has shown in US and many other countries in the world a very dramatic decrease in the cases of severe respiratory infections. And the challenge is now to implement this also in the low-income countries. And there is a very important organization called Gavi, Global Alliance for Vaccines and Immunization, with a headquarters in Geneva. They have made negotiations making it possible to sell the vaccines for $3.50 per dose instead of $95 paid in the rich country. And a normal vaccination program includes 3 doses. So these international organizations are very important. Here is a Buddhist monk I met in Yunnan, China, and he learns us a very important thing. He offers us with a certain price list to save the fish in the aquarium, to bring them back to the pool behind. And if you save 1 fish, you get happiness yourself. More fishes, you can get happily for your families, your relatives, and finally also for your business. But I want you to think 1 step further. What has happened during nighttime when the park is closed? Who is fishing up the fishes from the pool, bringing them to the aquarium so they are in need to be saved? We who are working at the hospital, treating and helping patients, are quite satisfied with that. And we are working in the same way. But we also need to think about, why does the patient get the diseases? Why do they need to get our help? We need to work also with prevention. Finally, if we have a good message, we need to spread it and do it rapidly. The picture to the left is from somewhere in Mongolia or Central Asia. You know, the horses is the traditional rapid way of transportation. And if we bring wings on the staples, it goes even more rapid. So that is their picture of the kingdom of God. And a poem from Kyrgyzstan in Central Asia says, if I have only 1 more day, I will stay at least half of it on the horse. So good luck with spread of your important and good message.